absolutely overjoyed to be here, and I'm really looking forward to hearing the stories from Caroline, Sally, and Amanda. I think one of the most joyous things about the work that they're doing is in relation to really helping us think, how do we bring to life the concepts that people have talked about so far? So the concepts of learning from excellence and appreciative inquiry and safety too are all kind of embedded in a really lovely positive approach to the way we work, not just safety. And what you'll hear as we go through this afternoon together, you're going to hear those lovely, lovely stories. What I'd like to hear from you who are joining is also your own stories, your own thoughts and your own ideas. And so what we're going to have is me talking for a little bit, then Caroline, and then Sally and Amanda, and then we're going to break out. We're going to actually talk through some of the questions that they may have helped raise and that we have for you as well. The first thing I'd really love you to do, and I know I've put that in the chat room as well, is to just introduce yourself, who you are and where you're from. I'd also really love it if you could answer a quick question in terms of a number. So how confident are you in applying appreciative inquiry in the workplace? So how confident are you in applying appreciative inquiry in your workplace? And 1 being you're not very confident at all, and 5, you've got it, you've nailed it, there's not a problem, I don't know why I'm here. So if you want to put either 1, 2, 3, 4, or 5, that would be really lovely. And what we're going to do is ask you that same question at the very end. So that would be great. But what I'd like to do is just kind of set the scene for both of the talks. So for the first slide, or the next slide, I'm going to talk you through our current approach to safety, and exceptionally briefly. I mean, you know me, I could go on for days. But our current approach to safety is predominantly focused on failure. So it is centered on things that have gone wrong, things that haven't been as great as they could have been. And then they tend to get then put onto incident report systems, and then they're investigated. And the focus is very much about how we have failed and how we haven't adhered to policies and procedures and not got it right. But what we do know over the last 20 years is that that has only given us a certain amount of learning. It hasn't given us what we would have really loved to have achieved, which is a significantly different way of looking at safety, a much more positive way of looking at safety. So if we have the next slide, I'm just going to give you a very quick overview of the emergent thinking. So the emergent thinking is that we in healthcare, everyone that works in healthcare, is working in a complex, adaptive system. What that means is that every day, everything is different. So something that we've done today will be different from yesterday and the day before and the day before and in the future. And if everything is different all of the time, then how can you make that as safe as it possibly can be? And can you describe everything? Can you put down everything that you need to do in detail in policies and procedures and standards and guidelines? And we would suggest not. We would suggest that those things can really help sort of frame and give you some roadmap if you like, but they don't tell you exactly what you need to do, because actually what you need to do is think about the circumstances and the situations you place yourselves in and find yourselves in, and you adapt and you adjust. But if you have a look at the next slide, you'll see our predominant way of looking at safety is down the one end, the sharp end of accidents, incidents, never events, and so on. But if you truly think about safety, as in, I want to be safe, I want to get from A to B, or I want to go on an aeroplane and arrive at the other end as safe as I can be, that's just normal day-to-day performance. That's getting through your day and thinking, wow, how brilliant was that? And sometimes it's exceptional, probably more often than not it's exceptional. But what we don't understand, therefore, is actually the whole picture of safety. We only understand the failure aspects of safety rather than the positive effects of safety. So the next slide then tells us that there are 5 key things the safety 2 can give us, the safety 1 can't. It tells us it's impossible to prescribe, so therefore we have to think about, so how do we make those policies and standards and guidelines really work for us? How do they make it so that we don't feel like we're being punished when we go outside of them? The second thing is, if it's impossible to make everything safe, predictable, reliable, and we can never achieve zero harm, how do we therefore work with a system to make it as safe as possible? And how do we learn? And how do we learn from the daily things that we do, the habits that we do, the kind of ordinary things that we do? And how do we learn from success? And how can we ensure that we actually value and understand how people have adapted and adjusted to the circumstances and conditions that they face? Because those people should be applauded for actually making care safer. And really importantly, how can we do that in a way that is very just and fair and consistent, so that when something doesn't go as planned or as expected, that we seek to truly understand that behavior rather than judging people, and it's often focused at people, as incompetent or incapable or even negligent. So the next slide then just gives us that summary of safety one, which is defined as a state where as a few things as possible goes wrong. And this is all the work of Eric Holnagol and lots of other wonderful people who work in things like resilience engineering and so on. And safety two, being safety, is defined as a state where as much as possible goes right. And I deliberately put that on a seesaw, and you can see that they are balanced equally. Now, maybe over time, we'd quite like that balance to be much more the safety two approach. But what we don't want to do is for people to feel like, so everything that we've done in safety one so far has been wrong and we have to ditch all of that. No, this is about the two of them, the balance of the two of them. So where does appreciative inquiry come into this? So if we move on to the next slide, we can see that there are some lovely definitions of appreciative inquiry. But if we take even just those two words, appreciate, I'm going to read this out because it's so lovely. It's valuing, the act of recognizing the best in people or the world around us, and affirming the past and present strengths, successes, and potentials to perceive those things that give life to living systems. How gorgeous is that? And a lot of us are wearing our Learning from Excellence lanyards today, because that's so embedded in what we feel that that is all about. But to inquire into that, and I would add a humble inquiry to that, is the act of exploration and discovery, and to ask questions, probing questions, open questions, to see the new potentials and possibilities. And that's what safety one and safety two does. That's what appreciative inquiry does. And that's what the whole way in which we think that we should look at safety is all about, exploring new potentials and possibilities in an appreciative and lovely way in which we recognize the best in people. So it is important to recognize the situation that we're in today. And the next slide, obviously, then brings that to the forefront. This is the time for us to notice what is happening now in order to learn from it for the future. Too often we go through a crisis and we think this is somewhat of a nightmare, or we're just getting through our day by day. And actually what we need to do is keep some sort of way in which we can reflect and record and have some sort of journalistic approach to knowing what is happening now in order to think about, so what will that mean for the future? So how do we do all of that? Our next slide gives us 4 key ways we might do that. Understand the system. To know is to know what goes on inside it. So it's the work as done, not the work that we imagine. Understanding that complex adaptive system I mentioned, by understanding the dynamic properties of healthcare and the way it's constantly changing and its unpredictability. And study those people, which a lot of people are starting to do now, about why they change and why they're constantly dealing with those dynamics and so on, and how are they doing that. And study that mundanity, the ordinary, and make the visible, the invisible visible. As I say, moving from the work as imagined to actually the work as done. So underpinning that, our next slide gives us those cultures, those ways in which we can support people to do this, which is obviously having a psychologically safe organization and environment around us. People are able to raise an issue, no matter what that issue is, any repercussions, and people care about those people speaking up. And a just culture is fair and proportionate and consistent, and vitally that we have compassionate leadership. And compassionate leadership, as we see on the next slide, is all about being fair and kind and caring, inclusive of all, no matter whether in terms of diversity, ethnicity, but also inclusive of ideas and thoughts and improvements and innovations. Be really respectful of people and the situations that they've been through, and respond to them, act on their behalf, and find out what they need, and increase that by helping them trust you so that you can trust them. And that means that you need to listen more than you speak. You need to learn more than you kind of audit or regulate. And we need to recognize and value others and help those people shine so that we can restore people's morale and the way in which they feel about themselves and the work that they're giving. Because caring for those that care is really at the heart of any planning for me. So in summary, the things that we are going to hear about today, sorry, I'm going to come back to that one, but in summary, the things that we're going to hear about today will be showing all of this. Some really lovely exhibition of compassionate leadership. So one quick thing that you could do is that you could take 5. At the end of your day, so this is my next slide now. So at the end of the day, you can just take 5 and ask 5 very lovely, lovely questions. How are you? How is everyone today? What did we learn today that we would want the next shift to know? What did we learn today that we'll take forward tomorrow? And what did we need to escalate for further support and help in the future? And what do we want to share more widely? And I'm absolutely sure that you can all think of some things where you every single day want somebody else to know about it so that they can learn too. So the summary of what we're going to be talking about today is kind of encapsulates the next slide, which is bringing to life safety 1 and safety 2, psychological safety, a just culture, the compassionate leadership, trust and kindness, and appreciative inquiry. So before I move on to Caroline, I'd just like to have a quick hand over to Helen just to see if she can pop into the chat room and let me know if there's anything that we need to think about before Caroline speaks.
Thanks, Suzette. I've done a quick tally here. I had to quickly get my skills out to keep track of the numbers, and it seems most people are being very in the 3 camp, that middle of the road. And Suzanne Quinney has quite rightly pointed out on the chat, she thinks people are underestimating their skills. So it'd be quite interesting to see what people think at the end. But we've got quite a few 5s, quite a few beginners, but middle of the road.
Oh, fab. No, that's fabulous. So, so those that feel less than confident, and at the end of this, Dan's going to point us to various things, and that you can then go on from here in search of resources and ways in which you want to find out more. But essentially, the stories will tell you a lot that will help. So I'm now going to hand over to Caroline, who's going to share her story. Caroline.
Thank you so much. Hello there, everybody, and thanks for that lovely introduction to today's webinar. I know that there are lots of friends and colleagues out there today, and though I can't see any of you, the power of technology has brought us together. Firstly, I'd like to say a big thank you to Helen and Dan for organising these webinars and for the opportunity to share some of my experiences of AI, and thanks to Appreciating People who first introduced me to the phenomenon of AI. And last but not least, I'd like to say a great big thank you to friends and colleagues from care homes across the region who I've worked with, and My Home Life, which is an organisation, and both the care homes and My Home Life have provided a platform for some of the AI experiences that I'll be sharing with you today. Just a little bit about myself. I'm a wife, a mum, and in my previous life, I was an ITU nurse. But more recently, I've been working with care homes, doing some quality improvement work. And I have to be honest and say I've used AI in all aspects of my life, but it's the experiences of AI within the care home setting that I'm going to focus on today. So I guess the question today is, can appreciative inquiry help in difficult times? And of course, I'd like to say yes. My experiences really positive with AI, but I really don't think how I understood how much how powerful it could be until I started to use the approach in some different ways. My journey with AI started back in 2017 with a 2-day introductory course from Appreciating People. It was a really inspirational course and lots of fun, and I could immediately see the potential of how Appreciative Inquiry could complement some of the quality improvement work that I was undertaking in care homes. This was in a project called Space that I was working in at the time. So I could have the next slide, please, Dan, that would be great. So in March 2017, I decided to apply some of the AI principles that I'd learned into the care home setting, particularly in care homes that I was working with, doing some quality improvement work. And at the time, there was a national initiative called the National Kitchen Table Week, which was part of the Sign Up to Safety campaign, which Suzette will be familiar with. This seemed a really great opportunity, but the National Kitchen Table Week was a week-long event, and it was about arranging and facilitating some conversations with staff in different care settings, and obviously this was the care homes, because we know that conversations can be really powerful, and if they're done in the right way, they can really lay the foundations for safety culture and help people to learn and share what they do well and to improve. So the care homes that I was involved with were really up for this, and they arranged a date and a time with tea and cake, as you can see. And they had a conversation with staff. They sort of advertised the events and invited people along, staff, residents and visitors. And I did about it a little bit in advance and prepared some questions to help facilitate some of those positive conversations, which if we have the next slide, please, Dan, that would be great. I'll just share some of them. These are just a few of the questions that we used, and we can share the full list of questions. We've got a facilitator guide, but they really proved a really great platform to start to get people to talk about what was good, their best experiences at work, you know, what motivates them, what inspires them, what makes them smile, etc. And though it sounds quite a simple thing to do, it actually is it needs to be handled quite delicately, really. And I was aware, and I'm sort of trying to think ahead and plan ahead, that there may be times when the conversations could become less appreciative, and I thought about some of the reframing techniques that we could use to steer things back on track. So, for example, if staff start talking about poor staffing or poor teamwork, you know, you reframe that into, okay, so what does great teamwork look like? Or, okay, so can you think of a time where you delivered great care when you were short of staff? And what was it about that day? What did you do differently to make it work? And to be honest, I didn't really have to use many of these reframing techniques. The whole experience was very rewarding and valuable to myself, but also to, I think, the people involved. We very rarely have the opportunity to celebrate what's good. So during those conversations, we got staff to sort of jot down on Post-it notes their thoughts and phrases and reflections. And by the end of that week, with all the different care homes, we ended up with a mass of Post-it notes with all this rich qualitative data. And it was sort of, what do we do? This is, you know, too important, too valuable to not share. So we looked at the themes that were emerging, and funnily enough, strangely but reassuringly, they fitted the CQC domain. So we sort of grouped them into safe, caring, responsive, effective and well-led, and they really did reflect those themes. And we then had a double whammy because we then shared that feedback from the staff about that collective group of care homes with the managers at a forum, and that really was another great opportunity of appreciating the feedback and sharing and celebrating it. So my next application of AI was a more challenging one, and if I can have the next slide, please, Dan. This was I'd been working with a care home for quite a while, and it was fair to say it was quite a troubled home with quite an autocratic leadership and a very demoralised staff with high levels of sickness and, you know, poor standards of care, really, I have to say. And in October 2017, they had a CQC inspection and were rated inadequate in all 5 areas. They were on the front page of the local paper. These are the headlines, and they actually overshadowed, the headline overshadowed a young boy that was actually killed, which, you know, was extremely tragic. I was asked by an interim manager was appointed, and I was asked to, you know, to help with that situation moving forward. And we started initially by sending a few staff on a one-day Appreciative Inquiry course. But we also worked with the whole team using some of the Appreciative Inquiry techniques that can be really helpful. I think one of the first things we did was we did some visioning with the staff. And if I can just have my next slide, please, Dan. So we got the staff to think about what is the vision for the future within this care home? Where do you want to be in 6 months' time when you have your reinspection? You know, what are your aspirations? And we used something called a SOAR analysis, which is a slightly different. Lots of people have heard of a SWOT analysis, but this is an appreciative version, and it stands for strengths. What strengths do we have? What opportunities? What aspirations do we have? And what resources or results do we want? What resources do we need? And what results do we want to see? And that proved a really, really good platform. We also did some practical tabletop activities with the staff to identify their individual strengths, but also the team strengths. And if I could, the next slide sort of shows a practical example of how we did that. So this is just a few of the staff, but we did it with all the staff group you know, in a couple of afternoons. We got them all in different groups. And when I say the team, I mean everybody. I mean the cleaners, the maintenance man, the cooks, the admin staff, the nurses, the carers, the manager, everybody. And we got them, they were a little bit, it was sort of out of their normal comfort zone, but you know, we got them to select their strengths and talk about why they'd selected particular cars and give examples. And it really generated some really great conversations which people were agreeing with and reinforcing. And that sort of then provided a platform for that visioning about where we want to be. We also reviewed the CQC report, which was quite damning, if I'm honest. But we picked out and held on to the positive elements. There were some positive elements in it, you know, so it was important to get the staff to look at those, because everybody always focuses on all the bad stuff. To see, you know, that there is a seed of that we can build on here. All of these approaches, I think, were really powerful, but probably getting the staff to do that visioning was really key. So one of the things that the staff said in that visioning was that they wanted their aim, you know, and it's about aspirational or achievable aims. They wanted by their next inspection to be rated good in at least 2 CQC domains. And I'm pleased to say that they actually achieved that in 4 months. And then a year later, you know, we continued that work, built on, and they actually received good ratings in all 5 domains. and they were overjoyed. And the manager, we asked the manager to share their care home journey at a conference that we hosted, and we captured this on video. And to be honest, none of us at the conference were prepared for the emotive, powerful delivery of this story. It really is worth a watch, and hopefully Sarah will post the link in the chat box, and we'll also upload the link. It's about 12 minutes long, but it really is worth taking that in and listening to that powerful story. So moving on to COVID-19, my journey with Appreciative Inquiry has been sort of an unexpected one, really. As I said at the beginning, I'm an ITU nurse, 20 years in ITU, and I left ITU many years ago, and I found myself sort of having retired and having a month's break, and I actually found myself, rather than being on holiday, I thought, well, you know, what can I do? And I ended up working back in ITU on the bank. And that really revealed to me how many changes and adaptations that people were making in the clinical acute settings. But also I spent some time thinking about the care homes. I was still in touch with many of them, and the feedback that I was getting from them, and they were really challenged, but they were really rising to that challenge and actually working in very innovative, creative ways to overcome all the barriers to lots of things like PPE and staffing, etc. And so I thought about how we could capture some of this, because we need to really capture it and learn from it and share it. So if I could just have the next slide, please, Dan, that would be great. So I drafted some questions sort of to try and generate some of those, to capture the changes, and get the staff to reflect on how they'd risen to that challenge, and here are some examples of the questions that we used. And I've put them alongside a My Home Life slide, because the My Home Life organisation is a great one, which follows the Appreciative Inquiry model, really. And I drafted some of these questions, and I sent them out to a couple of care home managers, sort of to test them out, really, in QI style, where we test on a small scale. And they fed back and said, yeah, these are really good, they're really helpful. So we then I sent out some resources to all the managers, suggesting how they could have some A3 flip charts on the wall with some of these questions to capture what the staff were saying, and all those positive things that were coming out of their response to COVID. The managers were so receptive. They were really keen to use them as a means of encouraging staff to reflect on their commitment, their achievements and creativity. And actually, I think the questions also they found helpful with building and supporting the resilience of the staff in these really difficult times. From the feedback that we've got from some of the managers, and they're still doing it now, things like sharing of PPE, which was in such short supply between the homes, having staff happiness calendars. They had so many donations of money and equipment by local communities. The increased and the embracing of video consultations with GPs, and the use of Facebook and social media to keep residents in touch, and being creative, having window visits and garden visits for families. And, little things like, one manager said, oh, we've got a resident that likes to wander, and the cleaner just follows them round and cleans the surfaces just to keep infection control on track. But one of the most evident themes has been around the kindness and caring of staff. And one manager said, and I quote, "I knew the staff cared about the residents, but I just didn't realise how much. I have been so humbled by them." And that was really powerful for me, sort of really touched me very much. And if I just have my last slide now, Dan, please. This is a really lovely, powerful image, and I think it captures the powerful ripple effect of appreciative inquiry. So at the beginning of my presentation, I remember I asked the question: can appreciative inquiry be useful in challenging or difficult times? And I think this image really does portray the ripple effect of how I started, with those National Kitchen Table Week conversations. Then we moved on to with a challenged home, how we could use the appreciative inquiry techniques, and then how we apply that and use it to capture the positives, the learning, the commitments, enthusiasm, and creativity of how care staff have risen to the challenge of COVID-19. I hope I've convinced you that some of these examples, that you find them helpful, that, just the practical applications of them illustrate how those simple techniques can be used and can be powerful. And I think this slide just sums up how small actions from individuals can have such a big impact and ripple out to have that appreciative lens. So thank you for the opportunity again. I hope some of my reflections have been helpful, and I look forward to hearing from you how you're taking AI forward. And I'll now hand back to Suzette, who's going to take us on to Sally and Amanda. Thank you.
Thank you, Caroline. What we will do is we may revisit, not this minute, but we may revisit the slide just before your last one, because I think that those questions are so lovely. We had some really, really lovely comments from care home colleagues who are saying this is a really brilliant story. What I would suggest is that you also think about writing this up as a blog, so that you can share this just as much as the recording of the webinar. And if it's not that clear, then maybe we can actually do that again, because I think it's so important that we actually get stories like this out. And so what I'm now going to do is jump forward from your ripple into another ripple, which is the adorable Sally and Amanda. So over to Sally and Amanda.
Thank you, Suzette, and thank you, Caroline. Those stories were truly inspirational, and the ideas that you've come from your care home will definitely be applied in other care homes. So we're going to start with a short introduction and a story about our appreciative inquiry journey. Hello, my name is Sally.
Hello, my name's Amanda.
We're grateful to our hospital team here in Oxford for giving us the time to be able to take part in this webinar. We're wearing our scrubs today. I don't know if anyone's noticed. Scrubs define us clinically, but they're also the uniform that brought us together. We've been friends for 10 years. We're mothers, wives, daughters, and doctors. We've both been practicing medicine for over 15 years, 12 of those in anesthesia and critical care. Drawn together by the highs and lows of medical training, not just the nights and the long hours and the difficult cases, but also raising a family and balancing work inside the hospital walls with life outside. So much of our medical training has focused just on the safety to culture, learning from mistakes. By shifting the focus onto learning from what works and adding in the safety to culture, our professional and personal lives have been immeasurably changed. Inspired by the work of Adrian and Emma Plunkett and the whole Learning from Excellence team, we helped to set up excellence reporting systems in various hospitals in our region to report and learn from what works. Next slide, please.
In 2018, we recognised the need for a collaboration, and we set up a community and network of healthcare professionals who champion excellence reporting, TREX, Thames Valley Reporting Excellence. 2 conferences later, the connections and shared learning continues to grow. Our formal training in appreciative inquiry came from the wonderful Suzanne Quinney from Appreciating People. We've been privileged to present and learn from the wider AI community at the life-changing World Appreciative Inquiry Conference in Nice in 2019. Building on the power of narrative discussed in the first webinar, we want to take you through the practical applications of appreciative inquiry in the clinical setting. heard why AI works from Helen, Dan and Alison. We want to show you where and how you can apply appreciative inquiry in hospitals or any healthcare setting.
Next slide, please. We've heard it all before, because negative news sells. And in this pandemic, the world's media have been provided with a constant feed of isolation, political scandal, and death. But in some ways, the pandemic is so overwhelmingly negative that people are craving positivity. Next slide. It has been a fertile ground for change and the acceptance of change. And what breaks through those negative headlines are rainbows in windows, singing from balconies, volunteers delivering food. Next slide. But as we entered April, our early focus in our hospital here in Oxford was preparation and the provision of care in the clinical setting. We looked at the Italian crisis unfolding and rearranged teams, expanded intensive care provision, and focused on simulation training with our Oxstar colleagues, and how we were going to cope with the large predicted numbers of patients presenting with COVID. By April, both Amanda and I lifted our heads and tuned our ears to the uplifting stories around us. We focused the lens on positivity. And in that refocus, we realized that we had a part to play in refocusing and changing the conversations around us. Next slide. Echoing Cherry Torres and Jackie Stavros, we wanted to inspire conversations worth having. We're going to tell you about one such conversation that spread and the positive ripple, just as Caroline talked about, that ensued, and how you too can change the conversation. Next slide, please.
Email communication has always been the first line of information spread, and more so now when groups of clinicians and multidisciplinary team members are no longer able to gather together due to physical distancing. This timeline takes you through how planting one seed of positivity can ripple out. In February, we had our first corporate communication about COVID. 1 month later, regular departmental emails started, specifically an MDT email covering the teams that staff the intensive care unit in our hospital. Much needed information about logistics and team strategy was shared, and we were always thanked for our efforts, but in a generic but meaningful way. A month into regular emails, there were no success stories. On the 2nd of April, during a training session, one of the senior doctors mentioned in passing that a patient had been discharged from the intensive care unit. A patient who'd recovered from COVID had been discharged from the intensive care unit. With the national daily death numbers and the hospital ICU admissions climbing, this was the first success story I had heard. I asked him why we weren't sharing this information in the MDT communications, and he assumed we'd all knew that patients had recovered. We tested his theory in the next teaching session. We asked all the attendees the same question, and what I heard from them was we all thought that everyone who went into intensive care was dying. There were countless patients dying in intensive care and countless patients who weren't even making it to the intensive care. What we needed was good news. What we needed was to hear about the survival. The next MDT email that arrived the next day really surprised me. There were headings for bed state, next steps, and then good news. We had some good news. There was enough oxygen and there was a story about recovery. There was some good news to be heard. The next 24 emails contained 14 stories of good news, messages about staffing levels, gratitude from nursing staff about the medical students who were volunteering on the ICU, how all the medical students were so cheery and encouraging, and how they were all helpful and team players. We heard about how 150 patients had been discharged from the hospital, and at the end of April, we started hearing positive feedback, even in the midst of tragedy.
Next slide, please. So we were spurred on by the positive news stories on email, but we wondered how we could encourage the conversations outside of the electronic and into the physical workspace. Anecdotally, we were hearing these stories. People were grateful in healthcare to have jobs. A well-being team was set up in our anaesthetic department, reaching out on so many levels to support those in clinical facing roles and those working from home. We wanted to capture these conversations, share them, but most importantly, learn from them. Next slide, please.
We thought about the generic thank you, and while it is well intentioned, it is missing the mark. If we could focus the lens on what exactly motivates the team, what they are grateful for, what they are proud of, we would understand their motivations and be able to realign our thanks with what the staff value. At its simple, the project was putting up posters with post-it notes on and allowing for openness and honesty. Next slide, please. Here are just a sample of the quotes. We've now put up 10 pairs of posters around the hospital, in the operating theatres, the maternity unit, intensive care unit. What I really enjoy about this project is the number of layers it has. On the first layer, people are stopping and taking time from their busy day to reflect on what they are grateful for and proud, and publicly share that on a post-it note. The second layer is the conversations that it generates, where staff are standing next to the posters and discussing them. The third layer is that we are conducting a qualitative analysis of the responses. If we can understand the motivations and values of the team, we can understand how we can strengthen and interact our relationships with them. Finally, what the posters have done is make us focus on what works.
Thank you. The next slide, please. I just want to take a moment to quote David Cooperrider here, when he says that the words we create, the words we use, create the world we live in. We could ask our team members what wasn't working and try to improve mistakes and fix the holes, a deficit-based approach. But instead, we tried to create a safety to culture, one where the focus was on what worked, what the teams were grateful for, what they were proud of. We wanted to generate conversation. You could see people poised in front of the posters, thinking about what they were proud of. Focusing on what works well and building on that will generate change in a positive way. Teams work together well every day, in this hospital, in every hospital around the region, and focusing on why and how they work well can generate a lasting change. This has fostered the culture of asking what works instead of telling what works.
Changing things is easy if we speak the same language. Understanding how we work, why we work, what motivates us, what we value will allow us to deepen our engagement and co-create a new environment together.
So we've taken you through two projects now, a focused conversation and the written word, looking at what works during a time of COVID. But I want to bring you back, those of you who were at last week's webinar, to a quote that Alison Jones shared with us from Diane Whitney. Servicing the good is not an avoidance of reality, but the best way to improve reality. So spurred on by this and drawing on our AI practitioner training, by asking the right questions, we took the project to the next level. We wanted to look at the narrative behind the changes that were happening around us. We knew there had been a lot of changes in clinical practice and the way we saw patients, and the word on the wards was that some of it was better than expected. In fact, some change that people have been trying to implement for months, even years, was happening in days and weeks. There were some unexpected gains. Could I have the next slide, please? We devised 5 generative questions for an online questionnaire. We didn't preface the questions as being COVID related, although our expectation would be that many would assume this by asking people to focus on the last 6 weeks. There were 5 questions. What changes have you seen? Which of these changes do you most appreciate? What opportunities have you taken? How have processes in your team changed? And what should become part of the new normal? Next slide. We sent this online anonymous survey to the anaesthetic, intensive care, and maternity departments. The project is still evolving with over 100 responses. But while our focus today in this webinar is not the results of our survey, but how to do it, I want to share with you a small selection of the responses. Suzette spoke about compassionate leaders. Listen to this narrative. Stop the command and control culture from returning. Seek the opinions of frontline staff. Listen to them and facilitate changes through them. While we all need clear direction, we are craving compassionate leaders to facilitate this positive change. In fact, change that will last beyond the immediate crisis. As Suzette said, it is time for us to notice what is happening now in order to learn from it for the future. If I now ask you to focus on the bottom right quote there in red, it talks about well-being. How many of your hospitals or care home settings have set up a NOVID or staff relaxation room? How many areas have set up well-being teams that feed into everyday work? We are recognizing that well-being is no longer, well, make sure you have some rest when you get home, but actually how we can practice well-being in our daily work. Next slide. So today we've shared some practical applications of appreciative inquiry and how they can be used in the clinical setting. No matter what your level of appreciative inquiry, we hope that you can see that it can be as simple as one conversation at an individual level, or I challenge you to take it to an organizational level and some of the management meetings that you might go to. All you need is the curiosity to start and the drive and support to continue. We want to take this opportunity to thank Suzette, Dan, Caroline, Helen, and the whole West Midlands AHSN for giving us this opportunity to share with you today and being our supportive AI team. I'll hand over to Suzette now. Thank you.
Thank you, Sally. I always find it very moving to listen to all of you. It's just so incredibly beautiful to describe how what you're doing is not only bringing to life the concepts and the theories, but what you're doing is actually reminding us of our humanity and our humility and our curiosity and our desire to care for each other and love each other in the ways that we can. And the power of the board and the power of those questions in relation to how proud and how grateful you are. Those are really beautiful things that I think that, as I've said in the chat room, that people just think is something we might do if we had the time. But they are fundamental to how that we can work together and develop the relationships that we need to actually do the jobs that we do. We need each other. And in order to need each other, we need to really care for and with each other. So an absolute joy to hear all three of you. I'm going to quickly hand over to Helen to see if there's anything she wants to bring out of the chat room before I'm going to just talk about two questions that we might have time to run over.
No, Suzette, I think you've sort of everything that's coming out, just that people are loving the resources. So I'm seeing a bit of a need there. So we'll make sure that we share links of where people can pick up these ideas and websites.
I totally agree. I think people are, so both Caroline, Sally and Amanda, all three, people are wanting to pinch your stuff. So is it possible that they can pinch your stuff and to use it and to grow with it and to learn with it themselves? I think that would be really lovely if they can do that. So I think that, sorry, say that again.
I was just saying it's all about sharing. I completely agree. And actually we wouldn't be here today if the team in Birmingham didn't share all their LFE, paperwork and stories. So it is all about sharing. This is not ours. This is ours. Everybody here.
Ours. Yeah, totally agree with you. So we thought long and hard about what kind of questions we might want to generate. I know that we've only got 10 minutes left, but that in itself, we can quickly just have a sense from all of you. So the first question that we'd love you to have a think about is, what opportunities have you taken given the last 3 months that you've just experienced? Your experiences, the feelings, the stories, your own narratives, what opportunities have you taken? And the second, which is really important, is how would you like that or those opportunities to continue? So of the things that you think have worked, the things that you've loved, the things that you thought, my God, if only we'd done this a few months ago, what are they and how would you like them to continue? And we'd love you to share that in the chat room with each other. That would be really, really great. Or any other questions or thoughts or comments you have about the two crucial stories or the multiple stories that we've just had. So what I'm going to do is leave that and give you a little moment of reflection and see if you want to just pop that into the chat room. People are really obviously quite shy about what they've been up to. So it's a really great point and a reminder. One of the comments in the chat room is it's been difficult to be positive in the current situation at work, and I can completely understand why you would be saying that, of course. However, I'm proud of my recovery team who've adapted and are continuing to do so. And I think that that's one of the things that I've heard time and time again. It has been really hard. But the adaptations and the adjustments that people have taken at very short notice and worked blooming hard to do all of those things is why we should be really grateful and value what those people have done. And to be proud and grateful for those people is really lovely. What I would ask you to do is have a really lovely think about how you can let them know that, how you can actually think and craft a really lovely kind of feedback, learning from excellence feedback story to that recovery team and tell them how amazing they've been. So somebody there's also saying they took the opportunity to return to ITU after 12 years, blimey. I'm a PICU nurse by background. I can't imagine going back and being on the front line. That takes a lot of bravery. Scary but amazing. So, and the fact that you were welcomed and supported is really lovely. And I think that that's the other thing that was brought out by these the talks is the importance of caring for each other, the importance of looking after people's well-being. And I have heard of a lot of people who've talked about how purposeful people took to understand what it must be like to be coming into their area, that it's a new area, new things have changed over time, but these people have, said, I'm going to come in and help, and how they've done and help them do that. And there are very practical ways that we can learn from all of those things. So I'm rushing through these. Helen, is there anything that you've found that you can want to share as well?
I think it's just people taking the opportunities. Somebody's mentioned about IT. I think we've all look what we're doing now. Normally this would have been a big event that we'd have found a venue in Birmingham near a train station and blah, blah, blah. Whereas look what we've done just with an internet connection. So, and I think I put on there about wellbeing hubs. So the host trust that I was in, they've been set up, and I just hope they continue because they were needed before the pandemic. So I just hope that they stay and we start thinking about staff and not just thinking of it, oh well, the pandemic's over now. So that's something for me. I'd like the opportunity was there and for us to continue it. I'm just trying to. You go so fast, don't you?
No, I know, but I think that's a crucial theme, which is providing the means to do it. So, we go to work, we start a 12-hour shift, we get through that 12-hour shift, and and off we go back home again, and then there might be another one and another one. But if you intuitively find a really easy way in which people can provide their feelings, their feedback, their stories, such as that Amanda and Sally have done, and also the way in which Caroline asked some really crucial but very simple, beautiful questions. So just understanding the power of the narrative and understanding the power of really good questions to draw out how people are feeling in a very simple, quick way. My take 5, I truly believe that all you need to do is spend 5 minutes or so at the end and the beginnings of shifts, and you'll build and build and build those conversations. So it's providing the opportunity to do that. So as it says here, sort of building things like building, the feeling of a coffee room chat. So this isn't about let's have a huddle and talk about safety. This is let's talk to each other as human beings and be really empathetic and caring and kind and all of those things that, but still help us learn about how we can do things differently. The speed of the changing of how we're doing things is as somebody says, awe-inspiring. Again, I've spoken to a number of people in different trusts, and they have said, 1 minute it's sort of they've had a way of doing things for 20 years, which they found clumsy or clunky, and overnight they almost changed it, and you just think, oh wow. And so I suppose the crucial thing is the second question. So there's a lot of the, wow, we've done this and we've done that and we've done the other. How and what would we like to continue? Because somebody also said to me not long ago, some people may actually say, do you know what, this has all just been a bit too much. And I'd quite like to just go back to the safety and security of what we used to do. That just feels, that's fine. I need some of that because it's all been hectic, stressful, and so on. And you might find that people might resist actually continuing some of the opportunities and think, I just want to go back to whatever normal is. And so I think another thing about us capturing those opportunities is to ask those crucial questions about what would you like to continue? What would we like to not continue, and be open and honest and have that great conversation about. I'm really conscious that it's now at 2 minutes to the end. And so I'm going to, in a moment, hand to Dan, but my first question is, my first comment is to say a huge thank you to the AHSN for bringing us together. It is always a joy to be with Caroline, Sally and Amanda, and such impressive, shall I dare I say, women. We've got to, you know, do the whole women thing. But I'm so proud. I am so proud to be part of this and to be part of something with all of you. And I'm really grateful that we've had this opportunity to do that. And I would like that to continue. So that's my summary of all of that. And so now I'm going to hand over to Dan, who's going to tell you a little bit more about next week and anything else that he thinks that you need to know. Dan.
Thank you, Suzette. And I just want to echo Suzette, but equally include Suzette in the thank you. You know, it's wonderful to have a series of hosts that are wanting to join us on this journey of appreciative inquiry and how we apply appreciative inquiry in care and health settings moving forwards, and how we sustain that moving forwards, more importantly. So thank you, Sally, Amanda, Caroline and Suzette. A wonderful session and lots of positive feedback in the chat. We will share all of the resources. So what we're looking to do is pull together a repository across the whole 4 sessions that will include all of the resources and links that we've pulled out in the chat or we've spoken about through the different sessions. And then bringing us on to next week's session, again, building on where we've been. So we've looked at the power of narrative. We've then moved and shifted the lens to an appreciative lens that looks at how we instill that in our conversations. And next week, we're going to look at a slightly different notion of post-traumatic growth. So there's many people, whether nationally or locally, talking about post-traumatic stress disorder at the minute during these clarifying times. And actually an alternative to that is post-traumatic growth. So the wonderful Jan Somers, who's joined us again on the call, so thank you, Jan, is going to join us next week to present and share his thinking about appreciative inquiry and how we can look and explore appreciative growth and equally post-traumatic growth. And that's going to be hosted by the wonderful Adrian and Emma Plunkett from Learning from Excellence World. So we're really privileged again to have a great set of speakers next week to allow us to move beyond those disruptive times, but still sustain that appreciative growth. We will share the chat and the recordings afterwards, like we did last time. And equally, directly after this session, you should all have the automatic email link to next week's session. It will be publicised again through Twitter and all of our networks, as similarly to the last 2 sessions. And we really hope that you're with us on our journey moving forwards. What I'd really like to do is just reflect on Suzette's original question of where you see yourselves in terms of application of appreciative inquiry. So if you give us just again a score of where you're at, 5 being very confident, 1 being that sort of limited confidence, because that will help us then of how we bring together that repository and share the resources. We're really hoping to continue the conversations even after the series. But thank you very much, and thank you again to our hosts and our presenters. Caroline, so what I really want to know from you is that we're in real tragic times at the minute. You know, COVID-19 has changed people's lives dramatically overnight. What I really want to know from your session is how you think that we can apply that appreciative lens in the tragic times or those challenging times? Because that's what everyone wants to know. It's certainly what I want to know.
That's a really interesting question, Dan. And I think when I've been having the conversations with some of the managers, when we've been sharing some of the appreciative questions, in those conversations, I think it's really important. What I found is really important initially is to acknowledge and recognise and give them an opportunity to talk about how difficult it's been, how we can't just brush off what the challenges that they've faced, and it's been so heart-rending, and they need to have time to get that off their chest and talk about how difficult it's been before you can then talk about the positives. And I think to not give them the opportunity to do that, to have recognition that it has been so tough, and and how they've been really at their lowest ebb with staff, with families, with visitors. They need the opportunity to what I call have hippo time, where we sort of wallow in the difficult times. And from my own personal experience of having difficulties in the past, you need time where you feel sorry for yourself and actually recognize that you've been through a tough time before you can then move on, and to not give them that opportunity to talk about the bad stuff to start with and acknowledge it and then park it before you move on, I think is really important.
So Caroline, just from my knowledge, hippo time, where did that come from?
So that's it's a funny it comes from a book called Sumo, which stands for Shut Up, Move On, and it was a sort of a self-help book that I bought myself a few years ago when I was really having a bit of a breakdown, if I'm honest. Had quite a few challenges in my personal and professional life, and it's a very easy to read book. I'm just trying to think who the author is now. I'll have to come back to you on that one.
That's fine.
But it gives some practical examples about how the biggest person, the person that can have the most influence on your life, is you. So it gives you some practical examples about how it's important to wallow in it and talk about the tough times, but then it gives you some strategies for moving on, seeing things from other people's perspectives, and then make the choices that you make going forward. So I found that quite helpful, the book.
Have a look at that. One that I've used, Caroline, is Benjamin Zander, and he talks very much about the body pulling down when we enter that negative state. So the body pulls down, instantly we become more negative, and then we allow what he calls the voice in our head to take over. So we're not good at this, or they're better than me, or I'm never going to be as good as her. And actually I found that, and there's a YouTube video which I
think I've seen that.
And he talks about teaching a class in the Boston Philharmonic Orchestra, and the grade for every student in his class is an I at the start of the year, and that's one of those notions of the 5D model in appreciative inquiry, looking at the dream. How do we envisage what we will become in the future? And then linking Zander to Do It Jones, who looks at how we move to the lens of celebration, and I think that's what we're all wanting to do, and that's to get to that lens of celebration during these times is a little bit more difficult. But I think what you said about having that opportunity of reflexivity to wallow and to understand where you've been, I think is vital.
That's great, Dan. Yeah, I'm familiar with both of those things, and they're really powerful. That the Benjamin Zander and the other one you referred to, both very powerful. Thank you.
Thanks, Caroline.
Okay, cheers.